Welcome to OpenEMR training. This section covers the basic workflow for a MedTech or an RN who's running the front desk and doing intake. I'm going to log in as the MedTech user. We're going to take care of putting in a new patient and an appointment for that new patient, and then we'll walk through the actual processing of that patient through the system. So the first thing we need to do is add a new patient. To do that, you go over here to the left-hand menu and add and click on New or Search. That will give you a demographic screen. As you can see on the screen, we're divided into three panels. The left panel is the menu and selection, as well as the patient search lookup tool down here at the bottom. And the top panel is typically what you're currently working on. The bottom panel is another category, in this case patient notes. You can turn the top and bottom panels on and off at will to add more space, and we're going to do that at this moment. So we're going to add a new person. The first field here is the first name. So we're going to add a new patient who's called in for an appointment. We're going to put in the basic information. The system will not let you save the record until you've completed all required fields. So you can skip the external ID. That will automatically be assigned a number that's used that way. Dates can be entered in several formats. It will convert them to the system format. You can also use the date selection tool like this. It's a little cumbersome for birth dates, but it's good for dates that are closer to today's date. Typical pull-down list for gender. Social Security number is a required field in this application. Now I'm going to show you, if I try and save this patient now, there are some required fields that you don't see, and it will tell you, please choose a valid address. So the address information is contained under the Contact tab or checkbox. There are a number of other items here that are also required. These are the three sections that have required data in them. So we're going to put an address in here. Emergency contact is required. Formatting is not important on the phone number. And HIPAA notice has required as to whether that's given or not. You can assign a provider here at this point or leave that unassigned. That is an optional feature. So now we're going to create that new patient. Once we have a new patient, we can then immediately add a new appointment, either by clicking the new appointment here or by going to the calendar. We're going to turn the bottom back on again and go to the calendar. This is exactly the same, clicking this add button. The only difference is you can see the calendar from here. So we're going to add this person. It's important that you select an appropriate category. Established patient for acute care, HRA, disease management, new patient. This is a new patient, and we're going to do a complete assessment, so it's HRA. We're going to set them up for a 2 p.m. appointment at the Roanoke office. At this point, you want to do a search for that patient because I didn't do it from inside the patient record. So there they are. You can add them. You select the provider, and that is all there is to that. So if you scroll down here, you'll see that they are on the patient. They are on there. Now, when they come into the office, you can click directly on the appointment line, and it will bring that patient up. First thing that we're going to do on the intake is enter their history information. That history information is located under Medical Records, History, and once again I'm going to turn the bottom screen off so that we can see more of this. The More button up here, whenever there is a More button, means that's where you click to edit the record versus viewing it. So we're going to click that, We'll go through the general risk factors in the typical review with the patient for known risk factors. And any exams and tests can be entered here, as well as this is historical data, so this is something the patient would fill out on their history application if they know it. So you may or may not have all this information to begin with. There's a section for family history, lifestyles, and other parts of the review. All right, so you can save that. And the next thing you want to do is enter issues. Issues are things like allergies, medications they're taking, etc. You go to this screen, you click Add Issue, you select the issue that you want to log. If it's not in the list here, you can just type in an issue. And select the appropriate dates if the patient knows them, etc. Save that. Each issue needs to be saved separately. So add another issue. We're going to add an allergy. There's an allergy here to sulfa drugs. Say that happened. That was discovered last year, and it's status quo. All right. So at this point, you can go directly to the encounter entry for this patient. You'll see the active patient is Sam Bond up here at the top. We can add an encounter. The encounter is the typical, this is a health risk analysis. Assessment. The visit category must be selected. It's a new patient health risk assessment at this clinic. The sensitivity level is used typically in acute care for adding a higher level of visual protection to the issue in case there's a sensitive medical issue that they only want the physician themselves to see, not even the med tech. You can associate a given older issues with a given encounter in an acute care case. In this case, we don't need to do that, so we'll just save the record. Once you're in here, then you begin to work this list. The clinical pull down over here gives you the list of forms that are typical for a patient visit. You don't use all of them in acute care or chronic disease management, but you will use virtually all of them in the course of a health risk assessment. So we've already entered the new encounter form. We'll go to vitals. So this is the vitals form, typical vitals entry. It'll calculate the BMI for you down at the bottom. And you pretty much walk down the list. The review of systems checks. These are a typical review of the patient's system. Anything that you ask about, you should check. At which point we get into the exam and screening. At this point, this patient is done from a med tech perspective, and the nurse practitioner would typically take over. So we're going to log in now as the nurse practitioner, and that will be in the next segment.